Hello, I hope all is well with you. Have you ever heard of ferritin? Do you know what it is, where it comes from, and how it can even lead to your death because it is too high? Well done! Ferritin is something that is hardly talked about. Be aware if you are feeling very tired. You know that feeling of lost energy, total tiredness. That's right, you have a lot of joint pain. You've noticed changes in your skin tone. It's worth taking a break and checking your exams. Before we continue, I'm going to ask for your like, subscribe to the channel, comment on this video, and also share it with anyone you care about. All knowledge is welcome. Let's get to the topic of the video. High ferritin in the body may indicate that the body is storing excess iron, a condition known as iron overload. Ferritin is a protein that stores iron within cells and releases it as the body needs it, functioning as an indirect indicator of iron stores. When ferritin levels are elevated, it may be a sign of conditions such as hemochromatosis, a genetic disease that leads to excessive accumulation of iron in tissues, or other problems such as chronic inflammation, liver disease, cirrhosis or hepatitis, infections, or even cancer. Additionally, high levels may be associated with metabolic syndrome or obesity. Symptoms of high ferritin often don't appear immediately, but can include chronic fatigue, joint pain, changes in skin color, a tan cast, abdominal discomfort, and changes in the functioning of the heart, such as arrhythmias. Treatment depends on the underlying cause and may involve dietary changes, periodic blood withdrawal, phlebotomy to reduce iron stores, or specific medications that help eliminate iron from the body called chelators. It is essential to investigate the causes with medical supervision, as excess iron can be toxic and lead to serious complications in the long term. High ferritin in the body is an indication that the body may be accumulating excess iron, or that inflammatory, metabolic processes, or even chronic diseases are unregulated. Ferritin is a fundamental protein that stores iron in cells, ensuring it is available for essential functions such as transporting oxygen through the blood, producing energy, and maintaining the immune system. However, when ferritin is high in the blood, it does not necessarily mean there is excess iron in the body, but rather that the body is on alert, and this can be a consequence of different conditions, from inflammation to serious illnesses. Iron, when balanced, is a vital element. However, in excess, it becomes toxic, promoting the formation of free radicals that damage cells and tissues. This imbalance can cause serious problems, especially for organs that accumulate iron, such as the liver, heart, and pancreas. High ferritin, therefore, should not be ignored, as its impact can manifest slowly and progressively, leading to silent complications that, if left untreated, significantly affect quality of life. How does high ferritin affect the body? Number 1. Liver complications. The liver is one of the main organs affected by excess iron, as it stores much of the mineral. When ferritin levels are elevated, liver overload can occur, leading to conditions such as hepatic steatosis, known as fatty liver, fibrosis, or cirrhosis, in which healthy liver tissue is replaced by scar tissue, compromising its function. Over time, this burden can progress to the development of hepatocellular carcinoma, an aggressive type of liver cancer. Even in milder cases, the accumulation of iron in the liver compromises the organ's ability to metabolize fats, proteins, and toxins, directly impacting the body's well-being. Number 2. Damage to the heart. High levels of ferritin can be extremely harmful to the heart, as the iron accumulated in the heart muscle hinders its normal function. This can lead to cardiomyopathy, a condition in which the heart muscle becomes weaker and stiffer, resulting in heart failure. Furthermore, iron toxicity can cause cardiac arrhythmias, irregular heartbeats, and increase the long-term risk of heart attack. Number 3. Diabetes and pancreas problems. The pancreas, responsible for producing insulin, is particularly vulnerable to excess iron. High ferritin may indicate that iron is accumulating in this organ, compromising pancreatic beta cells, which regulate blood sugar levels. This can lead to insulin resistance and, eventually, the development of type 2 diabetes. Furthermore, uncontrolled blood glucose levels generate a cycle of inflammation, further aggravating high ferritin. Number 4. Joint and inflammatory problems. In cases such as hereditary hemochromatosis, a genetic condition that increases iron accumulation, joint pain, stiffness, and inflammation are common. These manifestations occur because excess iron can be deposited in the joints, causing chronic inflammation and cartilage wear, leading to conditions such as arthritis. Number 5. Impacts on the nervous system. Iron, although essential for brain function, in high levels can be harmful. It promotes the formation of free radicals that damage neurons, increasing the risk of neurodegenerative diseases such as Alzheimer's and Parkinson's. High ferritin is also associated with oxidative stress, which impairs communication between nerve cells, compromising memory and concentration. Number 6. Hormonal changes. Excess iron can also impact the functioning of glands such as the thyroid and adrenal glands. The iron accumulated in these organs interferes with the production of essential hormones, leading to dysfunctions such as hypothyroidism, which affects metabolism, and chronic hormonal disorders, which harm the body's general balance. High ferritin can be caused by some factors. Let's get to know them now. Factor number 1. Genetic diseases, hemochromatosis. Hereditary hemochromatosis is one of the most common causes of high ferritin. This is a condition in which the body absorbs excess iron from food, even when stores are already adequate. This disease is progressive and, if left untreated, can lead to serious complications, such as liver and heart failure and diabetes. Factor number 2. Chronic inflammations and infections. Diseases such as rheumatoid arthritis, lupus, intestinal inflammation, such as Crohn's disease, and bacterial or viral infections can increase ferritin, as this protein also works as an inflammatory marker. In these cases, the increase in ferritin reflects the body's immune response and not necessarily excess iron. Factor number 3. Liver diseases. Conditions such as hepatitis, fatty liver disease, and cirrhosis often increase ferritin levels. This occurs because the damaged liver releases excess, stored ferritin into the bloodstream. Factor number 4. Metabolic syndrome and obesity. High ferritin is often associated with metabolic syndrome, which encompasses abdominal obesity, hypertension, high cholesterol, and insulin resistance. These factors contribute to a chronic inflammatory state that elevates ferritin levels. Factor number 5. Excessive iron supplementation. Indiscriminate use of iron supplements can lead to overload, especially in people who are not deficient. This is worsened when the diet is high in fortified foods or red meat. Factor number 6. Alcohol consumption. Excessive alcohol overloads the liver, increasing iron accumulation and increasing ferritin levels. Let's now look at some solutions to reduce high ferritin. Number 1. Phlebotomy, therapeutic bloodletting. One of the most effective methods for reducing ferritin levels is periodic blood withdrawal. This procedure helps to safely eliminate iron from the body and is the standard treatment for hemochromatosis. Number 2. Use of iron chelators. Medications such as deferoxamine can be used to bind to iron and facilitate its elimination through urine, especially in cases where phlebotomy is not feasible. Number 3. Changes in diet. Reducing the consumption of red meat, liver, and fortified foods is one item. Avoid vitamin C with meals, as it increases iron absorption. Increase consumption of foods rich in calcium and phenolic compounds, such as tea and coffee, which reduce iron absorption. Number 4. Treatment of underlying diseases. Controlling inflammatory or metabolic conditions is essential. This may involve anti-inflammatory medications, managing diabetes, and treating infections. Number 5. Regular medical monitoring. Perform periodic exams to monitor ferritin levels and adjust treatments as necessary. In this video, we learn that high ferritin is more than a high number on exams. It can signal serious conditions that affect vital organs and essential body systems. Identifying the underlying cause and adopting strategies to reduce its levels is essential to avoid complications such as liver damage, heart problems, diabetes, and neurodegenerative diseases. With medical monitoring and lifestyle changes, it is possible to prevent the harmful effects of high ferritin and ensure a healthier and more balanced life. Now, tell me if you already knew how worrying high ferritin is. Leave your comment below. Tell me which city you are watching this video from. I left 2 video suggestions for you at the end. I hope you like them. And finally, don't forget to support with a like. Subscribe to the channel and activate the notification bell so you don't miss any news. Stay safe and see you in the next video.